Thanks.
Well, doctors are reporting a drop in patient visits because people are worried about the planned $7 co-payment. The Australian Medical Association is saying that some Western Sydney GPs are reporting falls of up to 50% in patients since the co-payment was announced in the budget last week. It says other states are now experiencing a similar response.
Well, doctors are reporting confusion over when their co-payment will be introduced and just who will be exempt. Some GPs have sent text messages to patients telling them that the $7 co-payment fee is not yet in place.
Whatever change we make to the health system, it must make our health system stronger. And to make our health system stronger, we need to actually boost primary health care. We need to allow people to spend longer with their GP. We don't want to turn away mothers from vaccinating their children. That's a very important part of health promotion, health prevention. We do want to actually implement our chronic disease programs to keep people out of hospital, because that's the expensive part of the health system. So we have this new plan, this new co-payment, and we do know that there are sectors of the community that will have difficulty managing to these co-payments. It's for general practice and for radiology and pathology, those diagnostic services that we use to try to assist our patients to get better care. So those are the issues that we want to talk to the Minister about, to actually understand where this fits into the overall plan for our health system. So we are prepared to work with the government. We don't have a strong focus on rejecting this outright, but we do need to work with the government to make sure that the right people get the right services at the right time, not delayed, not in a more expensive way. If we're going to bring this in, we need to understand the reason. We need to understand how this is going to increase exposure to GPs and allow us to do our job better. And if it's going to do the opposite, we need to think about another solution.
The AMA's Steve Hamilton there. Well, one GP who says he's seeing firsthand a drop in the number of patients is Dr. Bastian Seidel, who is also the acting chair of the Tasmanian faculty of the Australian College of General Practitioners. And he joins us live from Hobart now. Bastian, thanks very much for your time. Take us into your surgery, in effect, into your waiting room. What are the patients telling you? Indeed, what has been the drop-off in patients?
Well, the policy hasn't even been implemented, but we do already see the negative impacts on our patients and communities. So we had patients cancelling appointments today to see their GP, but because they're actually unwell, they went to the local emergency departments, and some of them even called the ambulance service. So of course, that doesn't make any sense, because we want to get patients out of the hospital, back into general practice, because we can treat patients there so much more efficiently and effectively. So, the whole policy, just the announcement, had lots of negative impact on our patients.
Dr. Seidel, when your patients have been cancelling those appointments, has your front desk staff, have they been trying to explain to them that in fact the co-payment doesn't come into place for another year or so, and that they can come and get bulk billed in your practice?
Absolutely, but quite often, those cancellation has been made by friends or family members, and so that was really, really difficult to say, look, there is no co-payment. You can of course still come in, because again the policy hasn't even been implemented, and of course we need to see you because you're unwell.
Bastian, we've heard a lot about the problems and challenges that co-payments may pose for patients and how they read it. What about for doctors? What are the key problems that this co-payment system may well pose for a GP such as yourself?
Well, look, I think they are predominantly ethical issues. I've given the example that if I had a patient who is under palliative care, so who is in the last weeks or even in the last days of their lives, am I going to charge them a $7 co-payment? There is no way that we doctors are going to do this. Patients in residential care facilities, am I meant to charge them a $7 co-payment? I just can't do it. It's just highly, highly unethical.
We heard today Steve Hamilton saying that if we do stay on the same trajectory, we'll find ourselves in an unaffordable situation. Now, I presume he's been talking about if we do not focus on preventative health, the ramifications long-term will also be a huge strain on the public purse. What's your position on that? How important is preventative health as opposed to fixing everyone up when they're really sick?
It's very important, and there's international consensus on it. I'll give you an example. The federal government only spends $280 per year per person in general practice care, but the federal government spends 6 times that amount per person per year on hospital care. General practice care is so much more cost effective, so we're not achieving anything by penalizing patients to seeing their GPs. That's why it doesn't make any sense, because you don't save any money. And there is international recognition for how effective the general practice system in Australia works. So we are barking up the wrong tree.
How much comfort do you take on behalf of your patients from the Treasurer's comments that those on a chronic health care plan would be exempt from having to pay the co-payment?
Well, I think that's very contrary to what's actually detailed in the budget papers. The Treasurer rightly said that the actual chronic disease management plan is exempt, but we only would do this for a patient once a year or probably twice a year. But all other consultations, of course, are being penalized with $7. So a patient, for example, who does have asthma, they would have a chronic disease management plan. I would update those plans once a year. But of course, I would see them far more frequently, in particular children who have exacerbations because of infections. And of course, I would have to charge them $7 whenever they are coming in.
Dr. Seidel, looking at your practice purely as a business, this is a business, it's a, you have staff working there. Now, if those patients continue to drop off, what does the future look like for GPs, for practices around Australia, given that a lot of people might be trying to access those emergency departments, like you mentioned, and be avoiding going to the doctor for preventative health?
Yes, I think it's a massive concern. I'm getting reports from GPs who are just working alone in their own little practice. Often it's just a 2-GP practice, and there's no way they would find the money to keep going. We are talking about a 15% drop of their income. And they are doctors who are not in it for the money. They just want to provide a service to their patients and their communities. So again, if we penalize them, it really doesn't add up.
Bastian, if I could read to you what the Prime Minister has said. He's expressed his confidence that the co-payment is consistent with, quote, a strong and dynamic, affordable and accessible Medicare system. What do you think of that statement, especially his prognosis for what it means for the Medicare system?
Well, the main cost drivers for the Medicare system is hospital care and not general practice care. Again, we are spending $280 per person per year on general practice care, but the federal government spends over $1,600 per person per year on hospital care. That doesn't even include the contributions the states are making to hospital care. So again, general practice is very, very efficient already. So we are not going to save any money for penalizing patients to see their GPs. Not at all. On the contrary, we are actually shifting the cost to the hospital system, and that's already stretched.
Dr. Bastian Seidel joining us there from Hobart. We so appreciate your time tonight and for giving us an insight into what it's like for you on the ground there. Thank you.
Thanks for having me.